very excited today. This is our first training exercise in our new simulated surgery lab, which is a huge development in technology. Traditionally for this type of training it was done in a cadaveric lab, and not only is that it's relatively expensive, but there's a lot of variation in quality of the cadavers that you would get. This is easy. The specimens are very consistent from one to the next. The quality is always going to be good. And it's also convenient because people can come in here and work on their own. It's not like we have to order special specimens, keep them refrigerated, etc. until it's time to use them for training. These are basically a store-on-the-shelf item. And our fellows can come in, work on their skills whenever they want to. This lab fits in very well with the History of Texas Back Institute and being on the cutting edge and patient care, research, as well as education. And so we will have some research performed in this laboratory as well as hands-on training facility. It fits well into our repertoire. It's an honor to be the first designated training lab with this specific equipment in the United States, and it keeps us on the front edge and lets our surgeons and the fellows in training truly develop skills and learn. They can come in here and train on new technologies as well as existing materials.
Oh, I think it's exciting. This is something I've dreamt up for years and years. They train pilots on simulators, and there's no reason that we can't train our surgeons on simulators. But we didn't have the technology back then. But this is great because we can change out the modules, we can show the fellows and eventually doctors on new techniques rather than practicing in the OR, so that they have a feel for the flow and also for the instrumentation. So to me, I am really, really excited. Something I've had a dream about for a long, long time.
I think that this is the culmination of a lot of hard work and many years of thoughtful planning. This really represents a new paradigm for surgeon and fellow education. It's a very exciting time here at Texas Back Institute. It allows us to have hands-on cadaver-like training on demand for education, introducing new procedures without the requirements and messiness of a cadaver lab, and it really allows us to teach our fellows without any downside to real-life patients. And so this really represents the cutting edge of surgical training here in the United States, and will just continue to improve for years to come. Well, I think it addresses a number of issues with how we currently treat fellows. There are certain procedures that don't get done often, and so depending upon the variability or which rotation the fellows are on, they may just do it a limited number of times with an attending. And so this will allow us to make sure that every fellow is up to speed and well trained and safe and competent to do this on their own. And I think this is just the real tip of the iceberg for what we're going to be able to accomplish from an education and research perspective with this technology.